hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to present to you the #1 shoulder impingement exercise, Statue of Liberty. Brad came up with this name.
Statue of Liberty stretch.
Statue of Liberty stretch.
Mhm.
It's a self-treatment. And was it you that came up with the name, or was it a patient?
No, I did, but I'll tell the story.
He's so proud of himself.
You're taking my whatever thunder.
Yeah, I'm stealing his thunder. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And yes, we are still giving away stuff, Brad. It's amazing. We've been giving away stuff for weeks now. If you go to Bob and Brad at Facebook, I was going to say Amazon. If you go to Bob and Brad at Facebook, we got a giveaway going on right now. Another mattress. We've given away 2. We're giving away 1 more.
This is the third one and final one for the year.
Yeah, for the final one for the year, so you don't want to miss out on it. We do need your email because we have trouble getting a hold of the winner sometimes if we don't have it. So,
right.
So, all right, Brad, take it away.
Well, we're talking about shoulder impingement, probably one of the most common causes of shoulder pain, very typical with overhead reaching. And actually, I had a 13-year-old athlete. You know, he's in 8th grade, I believe it was, or is, and he's a football player and going into basketball, and his shoulder was painful, particularly up here and back here, and it was very consistent with impingement. So, thinking about impingement, and one of the treatments that we found to be very effective, very simple, you can do it at home, is through this book here by John M. Kirsch. You don't have to buy the book, but if you want to, you can. We're going to tell you the exercise anyways.
Sure.
But this is where we got the exercise. He's an orthopedic surgeon,
yeah.
and he came up with this after many years of studying it. It was so nice to write a book about it.
The book is full of case studies
Right.
of where he's found it really helps some people that were really kind of almost considered gone. I mean, you know, as far as their shoulder.
Their shoulder,
yeah.
right. Yeah, save their shoulder. Very simple treatment, and the whole book revolves around this treatment right here. But you need a pull-up bar, and you just hang.
Yep.
And we're not going to get into the details of why this works because we don't want to spend 20 minutes on this video. But the whole book explains it, and we've got other videos. But if you hang for 10 to 30 seconds, 2 to 3 repetitions, and you do that daily or even more than daily, 2 or 3 times a day, it'll help eliminate that impingement. It stretches out one of the ligaments in your shoulders and opens the space.
Gives you more room so you don't keep pinching that shoulder.
Right.
And you know, Brad, I'm experiencing this myself right now a little bit, and this has really helped. And one thing, like you said, on my case, I'd feel it pinch, and then it would stop up here.
Yep.
And that's depending
Painful arc syndrome.
painful arc, depending on where it is. But also, if I go like this and turn this way, it would really bite.
Sure. Yeah, and that's very typical.
Yeah.
So I've got this 13-year-old. He does not have a pull-up bar, and I'm thinking, how are we going to help this, young man along? Yeah, he's got basketball to think about.
Yeah.
And so we took the Booyah stick.
Yeah. Booyah.
Booyah. Which is a nice stick. We found that this works so good for so many exercises, particularly the shoulder. But this stretch does very similar stretch of the shoulder as the pull-up bar that Dr. Kirsch has done. And you don't need a pull-up bar. You just need, you can use a broomstick, any long stick. The Booyah stick works really well. And you're going to put it on a chair. Be careful you don't scratch the chair or something.
What's nice is that we have the rubber tips.
Yeah.
I mean,
so it doesn't slip.
Yeah.
Or, and it's safe that way. No, you're going to reach up, and this is why, the young man was going to leave, and he says, well, what's the name of that stretch? And I didn't have a name for it yet, and I was just thinking, the Statue of Liberty. Because this is how it works. You put it here, and you reach up vertical. It must be straight up, and you reach up as high as you can, okay? Oftentimes with impingement, like with Bob, you'll have pain here, but if you can get it up to here, particularly if the weight of the arm is being supported, it's not pain-free, or it's not painful anymore.
Yeah, even if it does hurt in this last range here, you can go ahead and put the arm up there. I mean,
right. Now, if you're really sore and this hurts while you do it, you're not going to do it.
Right, exactly. You want pain to be your guide.
Right, this should just be a stretch. Maybe a little pain, but not severe by any means. It's not ready for it, then you need to leave it heal if it's in a severe case. But in most cases, you can go up here and grab. Now, I'm going to show it from
Yeah, I was
this
going to
angle
say, show
now.
from the side. I know exactly where you're going here, Brad.
So right here, all you do is you simply lean forward, and that's putting a great amount of stretch, just like the pull-up or the hanging exercise that Dr. Kirsch recommends. And so it's here, and we stretch and relax.
And if you're more elderly, you know, on the upper side of life like we are, it's a lot easier to do this and have a pull-up bar, because you know a lot of times you don't have the grip to hold on to a pull-up bar.
There you go. Right.
So you know you're maybe not able to put quite as much stress on it as you would with hanging, but you got a fair amount.
Right.
So
and it's all leverage. You know, you may not be able to see this on the video, but if you do it, you'll see when you lean forward, it really stretches that shoulder out in a nice fashion. And again, 10 seconds up to 30 seconds, and then you're going to relax. You can let it down and relax and do 2 or 3 repetitions of that. And of course, if you want to do the other arm for a little maintenance, even if it doesn't have
a problem, you don't want it to have a problem.
Right, prevent it from having problems, you can do that as well. So
a variation I did of this, Brad, if you don't mind. I just if you have trouble holding, I put the other arm up there. I actually do it with this one.
And this would be standing?
Yeah, I'd stand or on a hard surface like this, and I have this one to help hold it in place. You know what I mean? So this one doesn't have to grip as hard.
Yep.
So
he's stretching this left shoulder right now.
Yeah.
Yeah.
It's just a variation.
Right.
Of it,
no, it's a good option.
So
just to finish his story, he came back. I treated him on a Thursday. He came back Tuesday. He was playing basketball, much improved. It wasn't 100%, but he was basically fine.
I'm surprised.
75% better.
When I do it, a lot of times, right after I do it and I move the arm, the pain is gone.
Sure.
Doesn't always stay away, you know.
Right.
But I think over time it's going to.
Right.
And in fact, it already is starting.
It needs time to get that ligament
expand
to stretch out and get that space of that the impingement is.
I don't want to give the impression that this is going to cure you overnight, because for some of you, if you had impingement for a long time, it might take weeks and even months of hanging.
Right.
But it's.
I'm optimistic, Bob. I'm thinking.
All right. Well,
I'm thinking weeks.
It's going to get you in the right direction anyway. So
yeah, very good. Anything else, Bob?
Well, we were looking up the Statue of Liberty, and she looks like she's holding a book, but it's actually a tablet. So you're going to have him hold the book by Kirsch.
Yeah, by Dr. Kirsch, and then
read
the book and do the stretch.
Now you look like the Statue of Liberty.
There you go. There you go. We don't want to insult the Statue of Liberty by any means, but we're just having a little fun.
Thanks for watching.